Thank you very much. As Alex has said, thank you very much for joining the presentation today, taking time out of your lunch break as well to join this webinar about risk assessing. So my name is Rhys Jones. I'm the Deputy Head of Compliance at Agilio, and I've been working in the dental sector now for about 13 years plus. I've worked both as an internal health and safety advisor for 2 large dental groups, as well as an external health and safety consultant as well for your smaller groups or your independent dental practices. So I've got experience from both sides of it. Today we're going to be talking about the subject of risk assessing. So what is a risk assessment? There are 2 words that I'm sure you're all very, very familiar with. But what is it exactly? What do we need to do with risk assessing? How do we do a risk assessment? And what are our obligations? What are inspectors looking at? So I'm going to be talking through all those points today to give you a bit of an overview of the subject. So first of all, let's look at our legal obligations. It's important to understand that risk assessment, or the requirement to do risk assessments, comes from the Health and Safety at Work regulations. That puts a legal responsibility on every employer and self-employed person to carry out a suitable and sufficient assessment of the risks at their premises. This has been backed up and supported and mirrored by our healthcare regulators, so CQC and HIW. Since they've come on board, they've replicated that requirement, and it's contained within the Health and Social Care Act 2008 for England and the Health and Care Standards 2015 for Wales. Both of those mirror management health and safety regs by requiring that we assess the risks within our healthcare establishments, and that those risks are assessed by a competent person. So what is a competent person exactly? So again, first and foremost, it's important to understand that a competent person is defined as someone with the necessary skills, knowledge, technical ability, understanding, communication, and attitude. And this again comes from the Management of Health and Safety Work Regulation. So it is a legal responsibility and an onus for us to have that person in place. So someone with the relevant skills is someone with a certified training qualification in identification, hazard identification. It is also someone with the relevant experience of dealing with risk assessments and undertaking them. Someone with the relevant knowledge is someone that understands the process or the task that they're assessing. And someone with the technical ability is similar, but it's someone with the knowledge of any equipment that's involved in that task or the process that they're assessing. The understanding, you've got to be able to interpret the relevant legislation and laws. You've got to understand what you're judging the assessment against. And you've got to be able to interpret that, as I said, and understand it appropriately. And then communication. You've got to be able to communicate to people effectively, those that are involved in the task or the process, because they have a greater level of understanding because they work in that process on a day-to-day reoccurrence. For example, I'm a qualified risk assessor, and I've been doing it for 13 years plus. But I wouldn't be a competent person if I went into an oil refinery, for example, because I don't understand the equipment in that setting and I don't understand the processes that are used. So I wouldn't be competent in that setting, but I am competent to do assessments in healthcare. And then finally on this is attitude. And this is very important. There's no point giving someone an assessment to do if they've got a poor attitude towards health and safety. If there's someone that takes risks or cuts corners or doesn't really understand the importance of it, you've got to have someone that's positively engaged with health and safety and risk assessments and understands the importance of it. So those are all the elements you've got to consider when you deem competence as someone in your practice or yourself to do the assessment process. But it's also important to understand that competence can vary depending on what it is you're assessing. So if you're assessing a low risk hazard or low risk process, something quite trivial, something quite small, then your level of competence will be at the lower level of the spectrum. But if you're trying to assess a higher risk hazard, things like fire, Legionella, asbestos, you will be required to understand a greater level of the technical requirements, the laws behind those. And if you try and take on those sort of level of risk assessments without the correct competence, behind it, then if something was to go wrong, you could find yourself in breach of the regulation that's on the screen, and you would have to then justify your rationale to a court of law. So that's competence in a nutshell. Base your competence on what you've got at practice level, the skills, experience, training you've got, and what it is you're assessing. So just to put this in perspective a little bit, competence is looked at by our healthcare regulators. They will make that judgment when they come into your practice. And these are two genuine quotes that we found within inspection reports. So the first one states that a lead nurse had used a template supplied to the practice from a compliance company to carry out a risk assessment. However, she had not received training to enable her to competently assess the risks. And the second quote, the registered person had failed to ensure that sufficient numbers of suitably qualified, competent, skilled and experienced persons were deployed. So again, assessors are looking at this. They will look at your assessments and then they will judge those assessments against the person that have done them. They will ask those persons questions like, what sort of training you've got? How long have you been doing these assessments for? What sort of experience and how comfortable do you feel? And they will make a judgment on whether that assessment is suitable and whether that person is competent. If they find that they're not, they will flag that up as part of their report and there will be actions in there for us to address. So it is very important to know that inspectors are actively looking at it. So what is the principles of risk assessing? How do we go through undertaking one and what do we need to consider? So first and foremost, a risk assessment is a logical process of examining your work environment for anything that could cause harm or ill health. And then ensuring that we have appropriate controls in place to minimize that risk or minimize the harm so far as is reasonably practicable. So again, what does so far as is reasonably practicable mean? It's terminology that's used a lot by inspectors. It's put into reports and it's put heavily into your regulations as well. So essentially that means balancing the risk, the level of risk against the cost. So that's the time, the expense to put controls in place, okay, and the effort to do that as well. So if the risk is low, but the cost is high and grossly disproportionate, then you can say that you've done everything that is reasonably practicable to do. But if the risks are high, then you would be expected to do more and contribute a higher level of cost or effort to put those controls in place. So inspectors and regulators will look at that and they will judge what you've done. Is it reasonably practicable based on your budget restrictions or the difficulties of your premises? You may not have the space, or your building may be a listed building, so you haven't got the capability to put certain things into place. So that's how they will judge it, but you will be expected to do what is reasonable. So for example, it wouldn't be reasonable to install a lift to get around the problem of a couple of steps that may be a hazard to certain people accessing your premises. But it would be reasonable then for you to expect that those steps are constructed sufficiently to make them safe for the people that can access them. So they will make judgments based on things like that. So there are 5 key components to carry out a risk assessment, and they are identifying the hazards, assessing the risk associated with those hazards, controlling the risk, recording the findings, and then reviewing those controls. So I'm going to go through each one of those steps now, one by one, over the next couple of slides and delve into them a little bit more for you. So first of all, identifying the hazards. Well, first and foremost, a hazard is something that has the potential to cause harm or ill health. This could be a piece of equipment, a task, or a combination of both. So again, an example would be if you wanted to assess your decontamination process, the process of sterilizing your instruments from dirty to clean. That would be the task. But then you could introduce the equipment into that task, things like your autoclaves, your ultrasonic bath, washer disinfectors, and the needles, the dirty instruments themselves. So you could assess the task, or you could assess the equipment, or the combination. So it's also important to broaden your perspective of hazards and understand that hazards can be categorized into one of 5 classifications. So when you're walking around your practice, having a look at things that could potentially cause harm or ill health, you need to think about all these categories. And I'll go through them one by one now for you. So the first one, as you can see, is physical hazards. These are factors that can harm the body with or without necessarily touching it. So the examples there are fire, electricity, radiation, height, slips and trips. So the with or without necessarily touching it, just to elaborate on that a little bit more, radiation is a good example. If you stand in the direction of the primary beam of your X-ray equipment, you are in direct contact with that radiation hazard. However, you can also be at risk from that hazard if you stand within a certain distance of it, anything less than 1.5 meters, for example. So if you're standing within that distance, you are exposed to the scatter that comes from radiation. So you're not necessarily touching it, but you're still at risk from it. So that's an explanation. And the same principle applies to fire and electricity. You can come into direct contact, but you can also be affected by it. Electricity, if it's a fault to your consumer board, electricity arcs. It will try and jump to find a natural way down to an earth source. And if that's you, it will jump to you to try and find that route. So again, with or without necessarily touching it. Then we have ergonomic hazards. So this is the interaction with the environment or objects that may cause discomfort or pain. So again, within our dental setting, we do all of these things. We've got all these potential hazards in place. Manual handling, working with display screen equipment, vibration, we use ultrasonic scalers a lot. So again, some people may be at more risk of using them. We've got noise. We've got a lot of equipment that give off high levels of noise, a compressor, for example. And poor posture. You know, when we're treating our patients and working in that surgery environment, we're doing a lot of twisting, bending, moving, adopting awkward postures. So we've got to be aware of these, and these are your ergonomic hazards. We then got biological hazards. So this is bacteria or viruses that pose a threat to the health of a person. Patients, they bring biological hazards or could bring biological hazards into our premises. We should be identifying risks such as HIV and hepatitis through the medical histories. And if those risks are present, we need to control them and manage them. We've got coronavirus. We're all very familiar with that now and the impact that that's had on society. Legionella, bacteria in the water supplies that we need to be aware of and control. And then mold and fungi. So not necessarily on the toast that you can see there, but as we enter the winter months and the temperatures draw in, we could start seeing damp and water ingress appearing into our buildings. And that could create mold on the walls and that release spores that people could breathe in. And those are a risk, especially for people that suffer from asthma, for example. So those are examples of your biological hazards. We then got chemical hazards. So substances that can cause changes to human cells or mutagens, as they're referred to. So again, in a dental setting, we deal and work with a lot of cleaning products and a lot of products to help us with the dental treatments themselves. All those products, or the majority of them, will be hazards within themselves. They will fall under COSH, or the Control of Substances Hazardous to Health, and we need to assess them. But also chemical hazards can be defined as dusts, vapors, or smoke. So if you think about working in a dental laboratory, if you've got a laboratory on site, if you're grinding down a tooth model or working with gypsum, then the dust particles that are released from that could be breathed in, and they could cause a hazard or a health problem to yourself. Vapors. So it's not just the cleaning products themselves, but under the right temperatures and the right environmental conditions, they can release hazardous vapors. So if you inhale those are a risk and hazard to yourself. And then smoke, not just from cigarettes, but if you think about fire as the physical hazard, smoke is the chemical hazard. So there are unfortunately a lot of people, when there is a big fire, more people die from smoke inhalation than they actually do from the fire itself. So that would be the chemical hazard. And asbestos, I've got that on here just to clarify that asbestos would be classed as a chemical hazard. That's because the fibers that are released from asbestos materials are a variant of dust. They're fibers that you can breathe in that get into your lungs and they can't get out of your lungs. They start to scar your lung tissue, and that can result then eventually result in lung cancer. So asbestos is a chemical hazard. And then lastly, we got psychological hazards. So again, things like stress, fatigue, bullying, harassment, and burnout, all things we've got to be aware of and control within our settings. we've got to manage these suitably, because if we don't, these can lead to things like anxiety, depression, or even suicidal thoughts. So psychological hazards are as important as your physical, chemical, and biological. So once you've walked around, you've had a look, you've identified what the hazards are, you then need to assess the risk associated with those hazards. So risk is defined as how likely it is that someone could be harmed and how serious that harm could be. So if you times the likelihood by the severity, you will end up with an overall risk rating. And I'll go into this a little bit more later on. But the higher the risk rating, the higher the risk, the higher the priority to put things in place. So to assess risk appropriately, you need to first consider who could be harmed. So don't just think about ourselves as colleagues and our patients. Think about other people outside of that bubble. Think about visitors that regularly come to your practice, even inspectors. You have to consider them as well. Consider maintenance engineers. So people come to service your equipment, do repairs on your building. Lone workers such as cleaners that may work out of hours. So consider who is going to be affected by that particular hazard. You then need to consider the severity of harm that could come from that hazard. So if you think about it on a 3-tier scale, low to high, your low would be a hazard that requires first aid treatment that you could deal with at practice level using your first aid supplies and your medical equipment. Then high would be your major severity. So that would be death or a long-term disability. So for example, if I fell off a ladder and broke my back and that put me into a wheelchair, then that's a long-term disability. It's affected my ability to carry out normal day-to-day routine. And I'm suffering with that for the rest of my life. So a major severity would be that sort of thing. A moderate severity would be, again, if I fell off a ladder, really hurt my leg, and it needed hospital treatment, so it took me out of work for a couple of days or a week, but then I was able to recover and return as per normal with no adaptations required, then that would be classed as a short-term disability. So once you've looked at the severity of that harm, you then need to consider the likelihood of that harm occurring. So your likelihood is what controls you've got in place. If you've got good controls in place, again, on a 3-tier scale, the likelihood of something happening should be low. But the fewer controls you've got in place, the likelihood would increase. Then you need to look at your controls. So then you need to consider what controls you've got, are they adequate? And you need to consider what your processes are at the moment. What is the equipment you're using at the moment? And what sort of training, supervision, and instruction are you giving to your colleagues? So those are the sort of things you need to look at. So once you've assessed the risk, you then need to control that risk. So again, as I just explained, you need to look at what you're doing at the moment and then decide whether you could do anything further to reduce that harm as far as is reasonably practicable. So to control the risk, you need to consider what is called the hierarchy of control. And an easy way to remember this is the acronym ERIC prevents death, or ERIC PD. So you must consider this in the order of priority from left to right as you can see it. You always start with elimination, because if you can eliminate the hazard or remove the need to carry out the task altogether, then the risk is gone. The hazard is gone, the risk is gone. You've dealt with it. Okay, so always start with elimination. If you can't eliminate the hazard, then can you reduce the risk to persons? So can you change a product? Can you use a less hazardous product over a hazardous product? And an example of that would be a good example. That would be Tipp-Ex, for example. Your standard Tipp-Ex is classed as an irritant. So you would have to assess that under COSH. But there are alternatives out there. You can get Tipp-Ex, which is eco-friendly and not an irritant. So by replacing that product, you've reduced the risk to persons. Then you need to look at isolation, which is can you prevent persons from coming into contact with that hazard? So can you put things in place like guards, shielding, fencing and barriers, those sort of things to prevent people and the hazard coming together? Then you have to look at control. So can you control the exposure to persons? can you change the methods of working to reduce the time, the frequency, or the number of persons that are exposed? Can you like change your rotas around so you've got more people dealing on a task rather than just having one person dealing with it that's going to unnecessarily expose them to greater amounts of time? Then you've got PPE, so your personal protective equipment. Do you need gloves, visors, masks, aprons, all those sort of things to, again, protect that person? And then lastly, discipline. So discipline is around your information, your training, your instruction, and your supervision. Have you got all that in place to train those people on not just the process or the task, but also on the risks? Are they aware of the risks? Are they aware of the controls and the safety measures that are needed to avoid harm or health? So you need to consider all these elements, the hierarchy of control. And again, you have to consider them in the order of priority from left to right. If you only go in there and consider PP or discipline and don't consider control, isolation, reduce, or elimination, then that isn't a suitable and sufficient assessment. Okay, you are still exposing those people to potential risks if there were better controls that you could have put in place. So once you've assessed the risk and you've looked at the hierarchy of control, I'm going to put that into principle now using radiation as an example. Okay, we've got a legal onus on us working in the healthcare sector to reduce exposure to persons so far as is reasonably practicable. And that comes from the ionizing radiation regulations 2017. So that's the legal onus on us and what we need to do. So by following the hierarchy of control, we need to look at whether we can eliminate that risk. And the answer to that is no, we can't. We can't eliminate radiation, or in the majority of cases we can't, from within our practice, because X-rays are critical to effective dental care. So in this case, we can't get rid of radiation as the hazard, but we can reduce it. We can reduce risk of radiation exposure to persons by ensuring that our X-rays are medically justified, another legal requirement under the IRMA 2017 regs. Okay, every X-ray has to be justified before we take it. So again, by doing that, we're ensuring our patients are not being subjected to unnecessary exposure. We're reducing the risk to them. Can we then isolate it? So again, yes, we can. We can isolate persons from coming into contact with that, specifically our operators and dental nurses. So we can incorporate shielding. Radiation will be stopped by certain materials, preventing it from going any further. Lead is the one that we're all familiar with. Lead will stop it dead in its tracks. But also solid brick walls can also be equally effective. So we need to look at our environments to determine whether we've got the right levels of shielding in place. And to do that, we need to consult with our radiation protection advisors. When we get new X-ray equipment installed, they should be undertaking an environmental survey of your surgery to determine what levels of shielding is required. Then can we control it? So again, we can control the extent of exposure to persons by ensuring that they stand a sufficient distance away from the source of the radiation. So again, if radiation will attenuate, it will naturally weaken after a certain distance, and the risk with it will become lower or less. So if operators or nurses are standing greater than 1.5 meters away, then the risk becomes less to them. So we can put controls in place to ensure that that is being managed. And PPE, there are things available to us like lead aprons and dose meters, but these are not always necessary in a dental surgery, because the number of exposures we take on a weekly, monthly basis should be well below the national guidelines and threshold level for exposure risk. So if you are using lead aprons or got dose meters in your practice and you want to know whether they're absolutely necessary for your requirements, then again, please speak to your radiation protection advisors. They will assess that and determine whether or not you need them. And then finally is discipline. So again, yes, we need to discipline our operators, our staff. We need to ensure we've got local rules in place, that people have been trained on those local rules, and that operators are up to date with their CPD in IRMA requirements. So as you can see there, from following the hierarchy of control, I've looked at every element, I've looked at them in order of priority, and I've put controls in place based on each one. Different hazards will require you to do different controls. Some you won't be able to eliminate, some you won't be able to reduce, but you always work on the next one down. And you have to justify why you haven't been able to isolate or reduce, and you've only been able to control or put PPE in place. So you have to look at them and consider what you can or can't do for each one. So once you've controlled the risks, you've had a look at the hierarchy of control, and you've identified the hazards within your practice, you have to then record your findings. You have to put that on paper for the purpose of audit and inspection, okay? And your written record must include a description of the hazard. So in the case I've just given, that's radiation, that's the hazard. So explain that. You have to then identify who's at risk from that hazard. So again, with radiation, that would be your operators, your nurses, and your patients. You then have to detail the adequacy of the existing controls. So what is it you're doing at the moment? Have you got your local rules in place? Has your surgery been environmentally assessed, and have you got the right levels of shield in place? Whatever you're doing, list those down. And then you have to list if there's anything further you can do. So if there's anything missing or anything you've identified that you're not quite doing at the moment, you have to put down as further actions required. And those further actions must be set on a list of priority. So again, using the hierarchy of control, if there's anything you can do to reduce the harm, that is your first priority. If you can't do that, but you can isolate, that's your next priority. So your action plan must be written according to the priority list. Don't focus on doing discipline or PPE first if you can isolate, control, or reduce. Okay, so you have to record all those findings. Once you've done that, you've done your risk assessment, you then have to review it. You have to make sure that those controls have been put in place and that risk assessment remains relevant to your requirements in your practice. Okay, so the general rule is that all risk assessments should be reviewed annually or earlier if there's reason to suspect it is no longer valid. So examples of this is following an incident. If you did have an unnecessary exposure to radiation, you'd have to review the risk assessment to find out what's gone wrong. Is the risk assessment relevant? Are all the details in it applicable? And what are the learnings from this incident? You have to put extra things into that risk assessment as your learning outputs. Another example is if you adopt new changes in process or new equipment. If you start working with a machine that people aren't very familiar with, then you need to look at the risk assessments for that to make sure that they're adapted to correspond to that new process or equipment. And if you've got new personnel working into your practice who are not familiar with certain processes or equipment, you need to again review your assessment. You need to review that assessment with that person, ensure that they're aware of the risks and aware of the safety measures that are required when using that piece of equipment or undertaking that task. You also need to review your assessments if there's changes in legislation and laws and requirements. So you need to make sure that that risk assessment is kept up to date with those changes. And as a result of audit of inspection, so if you've had CQC or HIW come out and they found discrepancies in your assessment process, they're not happy with the competency levels or the way it's been undertaken, then again, you must look at your risk assessment and the process, and you must change the way you're doing things. And then finally, you review your assessment following the development of better controls. So as technology advances, there will be things released to us that are better, safer ways of managing risk. And we must keep our risk assessments up to date with those changes. So safer sharps, for example, safer sharps didn't exist a long time ago, but now they're there. So do our risk assessments incorporate safer sharps as a suitable control measure to minimize the risk of harm so far as is reasonably practicable. So again, all reasons to review an assessment and keep it relevant. So the risk assessment process, it can be a little bit daunting. If you're not that familiar with it, if you haven't done a lot of risk assessments before, it can feel a little bit overwhelming to do. But there are lots of avenues of support out there to help with the whole risk assessment process. The Health and Safety Executive have got guidance and stuff. And there's companies such as yourself that can give you that can hold your hand with the process. Members of our iComply software solutions, for example, will have access to a vast library of risk assessment templates that have been pre-populated for you. So an example is what you can see on your screen, and I've listed a few others as well. But these templates will identify the hazards that are well known within dentistry, and they will identify for you the persons that are likely to be exposed to those hazards. And then more crucially, they will predefine the expected control measures that you should have in place. And those control measures have been written by industry experts that have been working within dentistry for a long time, or have been trained to understand the legal legislation and requirements. And through our consultation with healthcare regulators and that, we're on top of what they expect as part of the inspection. So we're constantly evolving and adapting the templates to incorporate those control measures as a standard. So help is available to you guys. So if you are using a pre-populated template, whether it's through us, iComply, or you've got a template through a different provider, or whether you're downloading one from the internet or obtaining them through forums, or maybe even creating your own, there are some things that you must do. You can't just simply print a pre-populated template or obtain it from whatever source it is and use that as it is. You have to tailor those assessments to your practice. You have to remove any identified hazards on the template that are not applicable to you. So you need to look through those pre-populated hazards and then match them with your practice and what you've got in place. So for example, if you've got a template that lists lasers as a hazard, but you don't work with lasers, then remove it from the template. Do not keep it in. Because at the end of the day, if an inspector comes on site and they review your template and see that you've got lasers in there, but you haven't got lasers on site, they will treat that as an insufficient template. And that goes back to the competency. Is that person competent to carry out that assessment because they haven't thoroughly done it? Okay, so you need to look at that. You then need to look at the who's at risk. So again, the templates correspond who is likely to be at risk from that hazard. But you, again, may have different persons working in your practice that haven't been accounted for, especially vulnerable persons. So young workers, migrant workers, new expectant mothers, and persons with disabilities. If you've got those people working and they're involved with that task or hazard, you may want to note them down to make it specific to them. And then finally, and probably the most important, is check the predefined control measures. They are generic, and obviously they're there to help, and they're there to cover all potential outcomes, but every practice operates a little bit differently. So you need to look at those predefined control measures and adapt them for your working processes. Do not leave control measures in there if you're not currently doing them. So for example, if you haven't arranged a PAT test in the last couple of years, take that out. Because if you leave it in there as a current control measure and your inspector comes and looks at that, they will see it and then ask for evidence of your PAT test. And if you can't give them that evidence, they will then go back to that risk assessment and go, well, the assessment hasn't been done competently. It's not sufficient. Okay. So it's better to take out what you're not doing and then put them in as further actions that are required. And I'll go on to that a little bit more now. So once you've refined your assessment template, once you've made it bespoke to your practice and your working parameters, you need to then assess the risk associated with those hazards. So on here, this example that you can see, the hazard is electricity. That's what we're assessing, okay? So we're not assessing the control measures, we're assessing the hazard, electricity. So iComply templates, to make it a little bit easier for our members, we use a simple 3x3 risk matrix to help with this. So this helps assessors determine that priority of risk, okay, by putting a score against that hazard. So to do that effectively, you need to think about the severity. So I mentioned this earlier. What is the severity, the most probable outcome if something was to go wrong when you're working with electricity? So using that as an example, the most probable outcome, unfortunately, is electrocution, which could lead to major injury or even death. So when we're talking about the severity of electricity, we would grade that as the higher level. We would mark that as a 3, a major severity, or a potential major severity. So we will list 3 as our severity. Okay. The likelihood then is the likelihood that someone could come into harm from that hazard, so electricity. And the likelihood directly links in with the control measures that you're currently doing. So again, by refining your template and making it bespoke to you, you should have a set of controls that you've got in place right now as it stands, okay? And your likelihood is based on what those are. So if you've got all the predefined control measures in place, then the likelihood of harm occurring should be low. It should be unlikely. So I would grade that as a 1. So I've got an unlikeliness of 1 because I'm doing everything that's expected of me to mitigate that risk. And I've got a severity of 3 because if something does go wrong, that is the potential outcome, electrocution, okay? The less controls you have in place, the higher the likelihood is going to be that something could go wrong and someone could be subjected to harm. So you have to make that judgment call based on what you're currently doing at practice level. And that's where those predefined control measures come to help you, because you can use them as a benchmark to mark what you're doing against. So if you've taken a few out of them, or if you're not doing pat testing, for example, then it becomes possible that something could go wrong. So you would grade it a likelihood of 2 against a severity of 3. If you're not doing a pat testing and you haven't got your mains electrics tested, which should be done every 5 years, then the likelihood would probably be a 3. It's likely that something goes wrong because you don't know what the state of your electrical installation is. So then you've got a likelihood of 3 against a severity of 3. Okay. So what you do then is you have to calculate those numbers. You have to times your likelihood against your severity to give you an overall risk rating. So in my example, I've got a likelihood of 1 because I've got all my predetermined controls in place and I'm doing everything that's expected. And I've identified the severity of the hazard as a 3. So I times a 1 by a 3, and that gives me a risk rating of 3. Risk 3 is my risk rating for electricity in this example. Okay. If, however, I wasn't doing some of the controls and I've got a likelihood of a 2, then I would times 2 by 3 to give me a risk rating of 6, or a 3 by 3 to give me a risk rating of 9. So if I've got a risk rating of 6 or 9, then that's a high risk. That's the end of the that's the higher end of the risk matrix. And I would then know that I have to put extra controls in place to reduce that risk rating back down so far as is reasonably practicable. Try and get it back down to that 3. Okay. So I hope that makes a bit of sense of how to assess and calculate your risk. Okay. And using the iComply templates to help with that as well. So when you're using pre-populated templates, okay, you still have to then follow up on those actions. So if you've identified there are further things you need to do, so if you're not currently doing a pat testing or you haven't got your mains electrics tested, those are not current controls, they become further action required. And you must detail those, okay? So you must detail them and you must work on those. If, however, you are doing everything that's required of you and you've got all the predefined controls in place, then you can simply mark down that there's nothing further you can do, NA. You have then done everything that is deemed reasonably practicable for you, okay? So once you have done that, recorded down your outputs of your assessment process, identified whether or not further actions are required, you must follow up on those actions. So if you need to do further things to control the risk, you need to follow them through. Risk assessments is not a paper-based exercise. It's not about recording down your findings and then filing it away. Assessors and inspectors will want to see the risk assessment, but they're going to be heavily focused then on how you've managed the outputs of those assessments, how you have shown proactive management of them to reduce the risk. Okay, so again, you need a mechanism in place to be able to manage that and see them through. And for iComply members, you can do that through our dashboard, through our calendar. All the relevant tasks, the risk assessments will been set up for you during your annual cycle. So as you can see on the example I've got there, my annual review of my health and safety risk assessment is coming up for next week. And I've got a pop-up through the software to notify me of that. So I've got a direct reminder that I need to do that. And through that pop-up as well, I've also got a direct link to that risk assessment template. So under the related templates and guidance, I can click on that link. I've got access to the template. I can fill it out. I can then save that update into the task, and it'll be there centrally held for me. If I get my assessments undertaken by a third-party assessor, so if I outsource my fire risk assessments, for example, then I can upload them into the task under the link or upload document section. But whatever way you do your assessments, whether you're doing them yourself or you're getting someone in to do them and uploading them, you need to review the action plan. If there are actions identified on those assessments, you need to follow up on them. And again, through the software that we've got available to our members, they can use the create related task function. So by clicking that button, you can create tasks, and you can then enter those tasks and manipulate them to what you need to do. So for example, PAT testing. If I was missing PAT testing as part of my assessment process for electricity and I needed to do that, I could create a related task, book in a PAT test. I can then assign that task to a member of the team if I delegate that to a head nurse who oversees compliance for me. They then will have access to the software and they will get notified that task has been set up for them. You can also then add a due date to that task to help you manage the priorities. So again, based on the hierarchy of control, the higher risk action should be done first. So you can assign due dates accordingly to that. You can give them a couple of weeks or a month or a year if you're looking at lower risk actions, just to help spread them out or give them some sort of order of priority. And then you can appoint reminders. You can assign reminders to those tasks to not just the person that you've delegated it to, but to yourself who's overseeing the system. So that person will get a reminder that they need to do it, but you'll get reminders to check up on them that they're doing it. So this sort of mechanism is great to show to inspectors how you're managing the outputs of assessments. So if you're not a member of iComply and you have been listening to this thinking, oh, I need access to templates, so I need help with risk assessments and managing the outputs of them, then please, a pop-up will appear now at the bottom of your screen. Please click this to book in a demo with one of our consultants. They'll go through the iComply system with you and talk through how it can support you in managing risk assessments. So just to put the whole risk assessments into perspective for you from an inspector's point of view, I've gone through numerous reports, both from the CQC and the HIW, to try and identify trends and patterns when it comes to risk assessing. And these are genuine quotes taken from certain reports. So the first one here states that health and safety risk assessments have been updated. We saw there were areas that could be personalized to the practice to ensure they reflected activities undertaken. So this mirrors what I was saying about not just printing templates, pre-populated templates, and using them in their current form. You have to make sure that you review those templates and tailor and bespoke them to your practice and your work and operations. Inspectors, as that quote states, are looking at this and they will judge you on that. Okay. The next two quotes then. We noted that the fire risk assessment did not include enough detail to adequately assess all risk in the building. And risk assessments had not identified potential risks at the practice, and the maintenance of equipment was not conducted regularly. So again, this links back to competency. The people that were doing these risk assessments at these two particular practices weren't deemed to be competent to do so by the inspectors, and that was flagged up as a concern and an action left behind for them to do it. So the person that was trying to do the fire risk assessment didn't have sufficient technical knowledge of the processes. They didn't understand how fire can impact the practice, the different fire resistance properties and materials, and what controls are suitable to manage that risk. So they shouldn't have done that risk assessment. Okay, so that's two examples of the competency that inspectors are looking at. And then the final two, there was no system in place to ensure that recommendations from the practice's risk assessment have been implemented. And the practice had undertaken a premise of risk assessment in 2018, but we found some of its recommendations had not been implemented. So again, this highlights the importance to ensure that you follow up on any actions that you identify that is needed to further reduce that harm to a person. Do not, again, just file away the paper exercise, but make sure you've got that mechanism in place to follow up on your actions, because inspectors want to see that. So I've also looked at risk assessment from a health and safety point of view. I've looked at prosecution cases that the HSE have released from the start of this year to now, to today. And altogether, there's been 116 HSE prosecution cases. The results of those cases are summarized in the bullet points. I'm not going to go into those details, but into too much detail. You can see them there for you. But what's important to note here, that is out of 116 cases, 75% of these were attributed to a failure in assessing risks appropriately and implementing the effective control measures. So again, this delves into how important risk assessments is. If you're not doing them properly and you're not doing them competently, then people could be hurt. That's the truth of it. People could be hurt, people have died. And this is an example of the percentage of failures in managing health and safety effectively. It comes down to risk assessment. The other percentage comes down to negligence or a failure in inspection and maintenance programs. So where people have blatantly ignored the laws and not done anything, or where they have done risk assessments effectively, but they have then failed to maintain the controls of those assessments and put in an effective inspection regime. But 75% just on the failure in doing the risk assessment initially. So what next? Well, if you feel that you need a certified level of training in risk assessment and you want to upskill your knowledge of it, then we would always advise the IOSH Managing Safely, the IOSH Managing Safely course. It's been designed to cover all sectors and is suitable for line managers. It helps them identify risks and identify hazards and assess those. Alternatively, if you feel you need some more personal support to help you with the risk assessment process and guide you through the requirements, then we, Agilio, we can offer you our new iManage solution. With this, you will be appointed a dedicated IOSH qualified manager or iManager to assist you with compliance and help you with reviewing your assessments to ensure that they are relevant, up to date and suitable. We have a few spaces left for our December input, but they are going fast. But if you would like to know more about iManage and how it can help you, then a pop-up will appear now at the bottom of your screen. So please click on it to book a free consultation, and they can talk through that software solution, support solution for you. So I hope that's given you a bit more of an understanding on risk assessments, the process of how to do one, and the importance of doing them effectively.